Marvin Hayes is a 43-year-old white male who underwent a laparoscopic abdominal resection with a permanent sigmoid colostomy 3 days ago for rectal cancer. The nurse is coming in this morning to do an assessment on Marvin. Come in.
Hi, Mr. Hayes. Good morning.
Good morning.
My name's Alyssa. I'm going to be your nurse today.
Well, good morning, Alyssa.
How are you doing?
Well, I'm hanging in.
Oh, good. I'm just going to wash my hands.
Great.
Okay. And first things first, I'm just going to check your ID bracelet and just verify who you are. If you could just tell me your name and your date of birth.
My name is Marvin Hayes, and my date of birth is 3/25XX.
Okay, great. And that matches your wristband, so perfect. Okay, so how are you feeling?
Well, I was having some pain this morning in my belly, but
Okay.
It's doing a little better now. They gave me, I think, that hydrocodone and Tylenol medicine,
Okay.
and that was about an hour ago, so it's starting to alleviate. They like to do those numbers, you know.
Yeah, so at this point, what would you rank your pain as on that scale of 0 to 10, where 10 is the absolute worst pain you could imagine, and 0 would be no pain? Where do you think you fall right now?
I fall about a 2 or a 3. It's going down to a 2 right now.
Okay, so that's good. So that sounds like the medication is helping.
I think so, yes.
All right, so we'll just continue to watch that, and you let me know if it changes, okay?
Okay.
All right, great. So I'm just going to take a look at your belly, make sure everything's okay. I'm going to look at the bag, okay? And then we can spend some time talking. And if you have any questions, you can ask.
Okay.
All right. I'm also going to do your vital signs.
Okay.
So I think I'll start with that.
All right.
So I'm going to put the O2 sat probe on your finger, and we'll see what it reads out. This will tell me how well you're oxygenating here. Any shortness of breath or trouble breathing?
No, I got a little tired when I got up to walk around a little bit, but I think that's just because I've been in the bed, but I feel pretty good breath-wise.
Okay, good. Yeah, you're reading 97, 98% on the oxygen saturation, so that's very good.
They gave me that contraption over there, and I've tried to use it during the commercials.
That's great. That's your incentive spirometer, and I'm glad to hear that you're using it. We can talk more about that later, but that's good that you're using it to expand your lungs, because we don't want you to get a pneumonia, right? We want you to be breathing and coughing to prevent, to get those lungs moving.
Yeah.
I'm going to take your blood pressure. Okay, great. Excellent blood pressure. It's 120/80. And I'm going to feel for your pulse. You have a monitor on you right now, so I can see what the monitor's reading for a pulse, but I'm also taking it manually just to make sure.
Oh, that makes me feel good.
Great. So, yep, you're about 78-80 for a heart rate. That's perfect in normal range.
Good.
And I'm just going to take a listen to your lungs. You can just breathe normally for a moment. Excellent. Your lungs from the front sound great, and I also counted your respirations while I was listening, and those are also in normal range. So you sound really good. when I get you up in a minute, I'm gonna listen to your back lung sounds as well. But from the front so far, they sound great.
Okay.
Okay, I'm going to take your temperature in a moment when I get the thermometer. So we'll do that in a second. I'm just gonna pull this sheet down for a moment so I can look at your belly, okay?
Okay.
And I'm gonna put your bed up a little bit so that I'm not bent over. I'm kind of tall, so I wanna make sure I'm not hurting my back. There we go, that just makes it a little bit easier for me to take care of you. So, I'm gonna keep you covered here, but I'm gonna pull your gown up a little bit. Okay.
Do you mind if I look away?
Oh, I don't mind at all. That's okay, I understand. I know this is really new for you.
Yes, it is.
I'm gonna just take a moment here to listen to your belly with my stethoscope. Okay, I can hear your bowel sounds. They sound really good in all 4 quadrants, as we call them, or all 4 areas of your belly. I'm just going to push down gently. You tell me if you have any pain. Any pain here?
Well, I'm just a little sore. I've been a little nauseous
Okay.
on and off. I haven't thrown up or anything like that, but,
Okay.
you know, my stomach, you know, kind of queasy, I would
Yeah.
say, just a little.
Well,
Not
that's-
enough to make me not drink, but
Okay, good.
just kind of not the normal.
Okay.
You know?
Well, that's understandable, you know, just a couple days after surgery, but we'll certainly keep an eye on that. You've had a lot of changes in your belly, so things are kind of still trying to get moving.
Ugh.
Okay. So what I'm going to do now is change your bag here. I'm going to put on some gloves. How are you feeling about everything?
Well, the bag just feels heavy and the smell is getting to me, and you know, it's hard. Just the smell itself, it just seems so potent. And I think to myself, you know, did you know I own a big Italian restaurant in Boston?
Oh, really?
Me and my brother. Yeah.
Oh, wow, I love Italian food.
Well, I do too, and I'm just so worried. You know, I love garlic and stuff, and someone came in who, you know, it was a cousin of mine, said, good luck with that. You'll never have that stuff again. And so between the smell and the garlic, I'm getting kind of moody, you know.
Yeah, I understand. I hear what you're saying. I know this has been a really big change for you and something you weren't necessarily expecting. And so I think it's going to take some time to adjust to it. But know that there's a lot that we can help you with. There's a lot of support. We have a few different people that you can talk to, like a nutritionist, who can help you identify foods and help you to understand how your body will kind of react to different types of foods. We also have a specialist called an ostomy nurse or a wound care nurse, and he or she can come in and speak to you about how to change the bag and
That would be good.
Yeah, because
Yeah.
it is a lot. It's a lot of new information for you, and it's a big body change.
Yeah,
and
it sure is. I mean, I almost feel like a baby. Before I went in, you know, my wife Caroline, I was like, hey, sweetie, you're going to have to do this dressing. And she's a lovely woman, but I don't want her to have to do all this for me. I've always taken care of my private situations like this. And I want to get this under control, but I feel like I'm a little shell-shocked right now, you know? I mean,
Yeah.
everyone says I should feel so happy that they got the cancer, and for sure I am, but this is just upsetting too, you know? And I think it'll just take a bit. If I can eat any kind of Italian food, it would be great, you know? I'll have you over to my restaurant if you can help me.
I would love that. And you know what? I don't think this means that you can't have Italian food. No one says that you can't have some of your favorite foods. It's all about learning how your body and how your intestines kind of respond, because it might be a little bit different than it used to be. And
Okay.
so, you know, you'll learn about that and you'll feel more empowered once you have the knowledge. So there's lots of things that you can do. You know, for example, I know you love garlic, and it's not that you can't have garlic, but I think you'll see that sometimes when you eat lots of garlic, it may make the output of your stool like more odorous. So if that's something that's concerning to you, you may want to experiment with maybe limiting the amount of garlic. But like I said, that's, you know, those are things that you can speak to our nutritionist about. She is an expert in that kind of stuff.
Someone said I should take some parsley and be chowing on that all day long.
That's another great idea. You know what? I have a whole bunch of teaching materials here for you as well.
Oh,
and
good.
we'll continue to talk about this during your whole admission and before you go home. But yeah, absolutely. I have like a printout here that you can take home with you. So, for example, things that decrease odor, like you said, parsley, buttermilk, actually.
Oh my goodness, I love buttermilk.
See, so that's, yep. So,
Oh, that's good news.
Cranberry juice, yogurt, those are things that
Okay.
will kind of help to counteract the odor.
Okay.
And then, you know, things to watch out for would be like the garlic, broccoli, eggs, fish, you know, probably limiting alcohol. That can cause an increase in odor as well. But you'll learn as time goes on, you'll learn what does work with your body and maybe what you want to limit or stay away from. You know, right now the output in your bag is pretty liquid, and that's normal for being so, you know, close to surgery. You just came out a few days ago. Over time it will thicken, but if you find that you want it even thicker, there's even foods that you can eat that will help with that, like applesauce and bananas, cheese, and pasta, which I think, from what you're telling me,
oh my
I
goodness,
think maybe you're a fan of pasta. You
I
probably
am.
make a really good pasta.
That's a relief.
Good. I'm so glad. So I know it's probably overwhelming, but we'll just take it, you know, one day at a time, and just know that there's a lot of people to support you through all of this and to help teach you. And again, I think the more knowledge that you have, the less anxiety you may feel, and the more empowered you might feel.
Okay.
And you feel a little more in control because you know what's going on.
That sounds like a plan.
All right. So I'm going to go ahead and just change this bag. What I'm going to do is just peel away what we call the appliance. It's just like a sticky adhesive on your belly, and the whole thing comes off, and I'm just going to gently peel it away, and you let me know if this is giving you any discomfort. Okay, excellent. Wow, that stoma looks great. The stoma is what we call the opening in your belly, and it looks really healthy. It's nice and red and beefy, what we call. So it looks great. You're really healing well from the surgery.
That's good to know.
I'm just going to document the output from the bag. I'm going to write down in my chart how much came out and what it looks like. And I'm just going to change my gloves into a clean pair, and I'm going to put a brand new bag on.
Okay.
I'm going to come over and wash my hands real quick. And so now I just have a nice clean one here for you. And it just goes right around that stoma and sticks right on. And I make sure I have it clamped at the bottom.
Oh, good. That's what one of my fear is that it stays on.
Yes. All right, that looks nice and secure. Pull your gown back down here.
So, Alyssa, being that you've been so nice and taking your time, some of the nurses I know are a little bit rushed, and they're very kind too, but there's something else that's really been bothering me.
What's that?
I have this wonderful wife, and we truly, truly love each other. And I don't know, it's kind of embarrassing to talk to a woman, but then again, you've been so nice, is that I'm really concerned about my intimacy with my wife and getting close to her again with this bag, with this situation. And it makes me kind of sad to think that that might not be able to happen like it used to. I don't really know what to do about that.
I hear what you're saying, and I know, again, this is such a big change for you, and it really affects so many aspects of your life. So I totally understand how that might be a concern or something that you're, worried and nervous about. I think, again, there's lots of people who can help you through that. I'm sure that your wife is going to be supportive. It sounds like you guys, from what you've told me, it sounds like you have a great relationship, and she will support you and help you through this. But if you need extra help, there's support people who can give you suggestions and help you, figure out what works going forward. But I totally understand where you're coming from, and I can understand how you would feel upset by that.
Well, thank you. You just this little bit of talking, even though we can't solve everything at once, I tell you, my heart feels better. I think that helps your lungs sometimes too, just to feel a little more relief.
Yeah.
So
good.
I appreciate.
I'm so glad.
Thank you.
You're welcome. All right. I think unless you have any other questions, I think we're good for now. I'm going to leave you for a few minutes.
Okay.
And I'll be back to check on you. I'm going to put your bed all the way back down.
Okay.
And I'm going to make sure that your call bell is right next to you so that if you need me, you can call me. So it's right here. You just press that red button.
Great.
Okay.
Thank you, Alyssa.
Oh, you're so welcome. I'll be back shortly to check on you.
Okay, I'm just going to rest here.
Okay.